Nurses from 6 Providence hospitals held a press conference outside of Providence Park Thursday morning, calling for better pay, working conditions, and health benefits.
We're having to ask for the bare minimums just to do our jobs. That makes it so frustrating to just be able to, take care of our communities.
Nurses at Providence St. Vincent, Newburgh, Hood River, Medford, Willamette Falls, and Milwaukee say they are burned out after working through the COVID-19 pandemic and are ready to be paid on par with other nurses in the area. They have now authorized union negotiators to initiate a 10-day strike notice if labor talks with Providence continue to stall.
I'm hoping that we don't have to do that. Strike is not something that is desirable, but sometimes that's the leverage that we need.
Providence executives hope they can reach a deal with nurses next week.
We want them to be well compensated. We certainly want to ensure that they've got a good work environment to practice. Our nurses are part of what gives us an excellent reputation in the community for quality of care and meeting patients' expectations.
Though contract negotiations have been happening since last fall, starting next week, both sides will meet alongside a federal mediator. Providence executives say they are ready to bring in replacement workers if nurses go on strike.
Our responsibility is to the community in which we serve, and so we will ensure that we've got a plan for a work stoppage.
Now, if union negotiators put that 10-day strike notice in place, discussions between the two sides could continue. But if a deal isn't reached in those 10 days, nurses could then walk off the job. David?
Yeah, a lot of uncertainty there. John Adams on the west side this evening. Thanks, John.